So, good morning, everybody. We're now on to part two of our tips of the week for September, when the new standards have come in from the HCPC, which I'm sure that you're all getting familiar with. There are just some changes. It's worth looking on the standards and then seeing what the changes are, because it lists all of the revised changes to the standards. So that's a quick way of looking about what's been updated. So today we're going to talk about EDI, which is a big theme now for the HCPC. And we're going to just think about, first of all, about reasonable adjustments.
Yep. Okay. So we'll talk a little bit about those because EDI, we could be here forever, Sarah, couldn't we? There's so many things we could talk about if we feature on a couple of things. So reasonable adjustments, when it's saying to you to make a reasonable adjustment, remember the focus is on the word reasonable. So it's, you wouldn't be expected to put a lift in if you're on a second floor clinic because your wheelchair couldn't get up the stairs, but you would be expected to see if it's possible to use another room to make it available for someone in a wheelchair, wouldn't you? Or potentially you'd signpost to somewhere else so that you aren't just leaving someone who's in a wheelchair unable to access treatment. But from a perspective of most people, the thing for reasonable adjustments is you could create a list of the things that you've done. So your reasonable adjustments could mean that you've got male and female individuals, so that if someone specifically asks for a male or a female therapist, you have those. If you haven't, you find clinics locally that would have. Also thinking about your calendar. Have you got times that means they're not discriminatory? If someone is fasting, can you fit around that? So you're thinking about those things. If somebody is hard of hearing, what have you done? What have you got in place? How could you manage that? Find out where your local sign language contact is. Could they help you if you needed to? Put that on your reasonable adjustments list. Think about Braille. Find out how you convert something to Braille if you had to do so, just so that it's there if you need it and it's on your reasonable adjustment list. And thinking about language as well. What sources would you use if you felt that you needed to translate something? There are tools out there that will help you translate. Think about that whole piece and your understanding around interpreters. Make sure you know what your professional body does in the case of interpreters, what they recommend, who can and who can't be used. And there's loads of things like this there, isn't it, that you could be thinking about, that you've got your list. But at the back of it, it's really important, isn't it, that we ensure our personal values and beliefs are influencing the way that we respond to these requests.
Yeah.
So, it's really important, isn't it, that you understand that?
Yeah, absolutely. And so it's all about unconscious bias, and we all have unconscious bias. It's just what we are and who we are. So it needs to be challenged. And the way that you can challenge it, there's a really good unconscious bias test on the HCPC website. And you can take that, and it's really good. And it just shows you where your points of learning are, where your points are that you could just need to perhaps just think about how you are and how you react. So I would really advise you to take that test, and just think about, so that we're not discriminating in any way, shape, or form. Okay, so hope you found this useful, and we'll see you next month. Bye bye.
Bye.